Thank you. It's old. It's about time for me to get it done over. And,
Hey, hey,
hey, how are you doing?
good. How are you today?
Fine. I was trying to find but I need to start uploading it in a folder. I'm trying to find the last part one, the notes that we took because I wanted to go back over the
Part
process of
one
therapy.
of.
Let me see if I can find it with you guys. We got time. When I emailed you guys like what was all involved in therapy, because tonight we're talking about is therapy for me. So I wanted to kind of review that. Um, Therapeutic space. So I was just trying to. Here it is. This it? Yeah, this is it. I found it. So Dr. Whiteman is not going to be on this evening. He had an emergency with a patient. A crisis. So, hold on for 1 second. Let me put this light down a little bit. Okay. So we usually give it about 5 minutes to let people log on. So let's give it about 5 minutes to give people time to join, and then we'll jump right in. So how's everything going, Wayne?
Oh, everything uh, going well on my end. There's a lot of new things coming up. Uh, you know, Melissa just started her own practice. She is
Really?
official as of today. This is her first day to be in her own practice, seeing
Wow,
clients on her
congratulations.
own.
Like she opened up the doors to her own practice?
Yep, Shades of Therapy is the name of her practice. She is official now. Yeah,
Oh my gosh, we have to talk about that.
yeah,
What time is it? We have three more minutes and then we're going to get started.
yeah. So that's been a lot for us, just getting everything in order for that, getting everything in place that we need so she can start to, obviously get all the paperwork and everything. She can start to see clients and so that starts today. Yeah,
Oh, she should be so excited.
she is nervous and excited all at the same time.
me give it about 2 more minutes and then we'll get started. Oh, well. So tonight we are going to be talking about, is therapy for me? So kick off your shoes and relax, because you know how we do. We just come in here and relax, and there's nothing too formal. So that is awesome news. I
Yeah.
can't wait till I open up the doors.
Yeah, so it was a long time coming. It was something that needed to be done.
Mm-hmm. Right. Guys, I'm eating a kale salad with apples.
Oh, amazing.
Mm-hmm. So, are you coming to the meeting tomorrow?
I have a client. Remember, every Tuesday my clients are
Oh, okay.
from 2 to 5
That's
on
fine.
Tuesdays. Yeah.
Because you're not writing in this upcoming magazine, right? Anyway,
Mm-mm.
so.
Yeah, I might try to show up if my client leaves early. Sometimes I'm done early.
Mm-hmm.
I'll show up at 4:30.
Okay.
Well, 7:30 your time.
Mm-hmm. That's fine.
Yeah.
Mm-hmm. That is fine.
How's your weather out there today? We overcast and cool all week.
Oh, this
We're in the
weather is
70s.
beautiful. It's in the 80s out here. All right, let's get
70s.
started. Hey
Yes.
guys, this is Dr. Leslie Rogers with Mental Health Talk, owner of the Mental Health Talk magazine as well, which we'll talk about in a little bit. And Wayne Lassane, who he just disclosed his wife just opened up her own practice. She's a licensed clinician, and so we need to congratulate him.
Yeah.
Woo!
Yeah. Excited.
Congratulations.
Yeah.
Wayne is working on getting his certification too, so
Yes.
that's going to be an awesome experience once that takes place. So we wanted to jump on here tonight and talk about, well, let me go do a little some admin stuff. So we are now starting a summer episode. So we're going to go every other week through August, I think. So today is summer 1, episode 1 of the summer. Thank you guys for supporting us and being here every week. Yes, we are going to come back. I've been getting messages asking us to come back. Don't stop for the summer. So we're going to go to every other week so that we can have some self-care and some time off for ourselves. Then we'll take a break in the fall and have 2 weeks off, and then we'll come back every week. Right? That's what we decided,
Yep.
right? Yeah. So a little bit of admin. So the Mental Health Talk magazine is going well. It's really amazing. Oh my gosh. So we already came out with an issue last month of the Mental Health Talk magazine. Allison Williams is on the cover. You guys know her. Just call my name and I'll come running. Allison Williams is on the cover. She's talking about her relationship with Phyllis Hyman, and the great Phyllis Hyman, who was amazing, who committed suicide some years back. So she's talking about that relationship and how her death impacted her. So that's a great article in this magazine that just dropped last month. We're working on the next magazine to come out. The magazine is quarterly, so we have another magazine that's going to come out in another couple months, but we're working on that now. And guys, let me tell you, we have some amazing writers that are coming forward to write. I mean, professionals, medical professionals, mental health professionals, regular people just like you and I or everyone else. You know, we have some amazing content that's going to go into these magazines. And I have a surprise for you guys. I'm going to wait because I have a meeting with the writers tomorrow, so I want to tell them first, and then I'll come back on here and let you guys know, so I won't spoil the surprise. But a big surprise is coming up with this magazine. So if you guys, or if anyone is interested, we always accept writers. The magazine is not a bunch of jargon. It's about real life experiences spoken from us to build rapport and to build those connections and be compassionate, empathic, and things of that sort. And it's relatable because of that. So if you know anybody, we have several art columns. I just established a new column in the magazine. It's actually a book within the magazine, and it's called United Heroes. That's representing law enforcement, military, and firemen, first line responders around mental health. And I also, there's a new column called Silent Hallways, which is amazing as well. Silent Hallways is for us, the professionals, the mental health, medical professionals, to come together and talk about our own struggles with mental health. I mean, we saw that big time during COVID. A lot of us struggled during COVID. And, you know, who was there out there for us? You know, we were busy offering these services and giving these services, servicing everyone else. Sometimes we felt like there were no services out there for us, and we got burned out. You know, we became depressed, we became anxious, we were too dying, right? So a lot of things were happening to the clinicians themselves. So Silent Hallways covers, you know, our very own experiences around mental health. So this magazine is just amazing. I'm so proud of what it's flourishing into. So I hope that you guys can, Wayne, can you type the website on there for me, please? mentalhealthtalk.live. Get your copy, mentalhealthtalk.live, LIVE. You can buy a single copy or get the subscription, but these magazines are amazing. So thank you guys for those of you who have bought copies already. They're with the printer now, so they'll be being shipped out soon for those of you who have pre-ordered the spring issue with Allison. So tonight we're going to talk about part 2. A few weeks ago we had a couple guests on, but a few weeks ago we had part 1, and we talked about a therapeutic space and the therapeutic process and what that looked like. So tonight I thought we'd expand on that and talk about, is therapy for me? So you know, guys know the title of this live that we do every week is Let's Talk Men's Mental Health. But it's not only for men, it's for women too, right? I have a son, I have a brother, you know, I have you know, uncles and father and things of that sort. So, you know, it benefits women as well for being in here. But the focus is around men's mental health. And tonight I wanted to expand on that and talk about, is mental health, how do we know that we need therapy, or is therapy for me? Mm-hmm. So before we get started, let me just review a little bit and talk about that process and what that process looks like. And so again, when you go to therapy, again, you do your due diligence and you look for a provider that meets your needs, whether it's you're feeling down, a little bit down, think that you may be depressed or feeling anxious, think that you may have anxiety, or whatever the case may be. You reach out to your insurance, first of all. Reach out to your insurance and see what insurance you have and what they support. Most insurance companies, guys, will give you a list of clinicians in your area. Did you know that? You call them and they will actually give you a detailed list of providers in your area that accept your insurance. Then you reach out or you do your due diligence and research them and see what their specialty is. Do they specialize in anxiety, depression, PTSD? Like I said last time, a lot of people don't know this, but a lot of psychologists and a lot of clinicians might not specialize in trauma. I work with trauma. However, I don't work with eating disorders. So if someone was referred to me and have an eating disorder, then I would have to refer out, because I don't work with people with eating disorders. That's out of my competency area. So make sure you guys understand what the providers that you look for specialize in. We also talked about, you know, those acronyms behind everybody's name, like PSYD. Like I'm a PSYD, doctorate in psychology. You have the PhD, Doctor in Philosophy. You have the LCPC, Licensed Clinical Professional Counselor. You know, all that means is that we just have we went through different trainings.
Yeah.
You know, the PhD and the PsyD are both doctor level degrees. And then the LCSW, like a licensed clinical social worker, LCPC, licensed clinical counselor, and their master's level degrees, right? So it's just a matter of degrees and different disciplines, but we all pretty much do the same thing, right? When you become a doctor, you can do probably more things. You have you do extra stuff like I do assessment, like testing and stuff like that. A lot of people, you have to be specialized to do testing and things of that sort. So again, it's important to do your research, guys, around that. So once you've identified a person that you like to engage with, then you would have what's called a triage, right? A triage just means, just like in a hospital setting, a triage just means that you come in, you go over all the consent forms, you go over your insurance information, you give consent to payment, like if you're going to pay via credit card, etc. All that paperwork is done during the triage, right? And then from that, then they set you up with an intake session. And this is how most offices are. They set you up with an intake session, and an intake is when you actually go to the provider and you give them the information about your presenting problem. What's going on, right? The intake takes about an hour, and during the intake time, usually is when the diagnoses happen too, right? For insurance companies, they most of the time wants diagnoses to happen during the intake phase, right? With testing, psychological testing, diagnoses are given too, but the more concrete diagnoses are given once the testing is complete. So if I do an ADHD testing, for example, I'll maybe put unspecified ADHD because I haven't did the test yet. And then once everything is done, then I'll solidify it and say ADHD and what kind of ADHD it is. So you have your intake session that gathers information, and then after the intake session, then you're on a schedule for therapy. Once they find out what's going on and what you need, you're in on the schedule for therapy. And one thing is important, I want to let you guys know, because I just told somebody this the other day, diagnoses. Diagnoses are from mild to severe, right? Mild to severe, right? Depending on what diagnosis it is. Don't let diagnoses be a crutch for you. Diagnoses really, and there's some clinicians that don't even use diagnoses, right? Some disciplines that don't use diagnoses, but diagnoses really are to help us, guide us to formulate treatment plans. It lets us, the clinician, know what's going on, so we'll know how to treat you, what theory to use to treat you, what model would be appropriate to treat you. That's what diagnoses are. So when you're diagnosed with ADHD, please don't let that be a crutch and say, I have ADHD, so I can't do this, right? Don't use it as a crutch, because you don't want that to cripple you going forward, right? And we'll talk about that in another session. But I just had to put that out there. So once you have the intake, then you have the first session. The first session is geared around building rapport building, and getting to know what it is that you're going through. The intake, just you gather information around your presenting problem. Then once you go to the first session is to kind of do a deeper dive into your presenting problem to see what's going on, right? To see if there is, in fact, anxiety, trauma, etc. So with me, I usually at least take about, depending on if it's a child, a male, special populations, we talk about men, right? Special populations with men, children, or if it's an adult, whomever it is, it may take me a few sessions to build rapport, and so that we can get used to each other, and so that you can get comfortable talking in that environment. But as soon as you walk through that room, we're doing therapy. Whether the focus is on rapport building, or whether the focus is on getting to know each other, it's therapeutic from the first day you walk into session. Okay. So, psychiatrist versus psychologist. You guys know what that is, Wayne? What's the difference between a psychiatrist and a psychologist?
One can prescribe medicine and one
Right.
can't. Yeah.
Exactly. A psychologist, you know, my family used to always say, Leslie's a psychiatrist. No, I'm not a
Yeah.
psychiatrist. A psychiatrist goes to medical school too. They're
Yeah.
actually medical doctors. They have an MD behind their name, right? They actually go to medical school. So I am not a psychiatrist. So the difference between a psychiatrist and a psychologist, one prescribes medication, one does not. One does talk therapy. Okay. Psychiatrist uh, um, prescribe medication. And now you also have psychopharmacologists that prescribe medications. You have psychiatric nurse practitioners who prescribe medications. And you have others who prescribe medications too, who have training. The difference is some people can prescribe opioid medication and some people cannot, control substances, and some people cannot with their licensure. So those are differences that I thought was very important. Also, you have group versus individual psychotherapy. Individual psychotherapy is one-on-one. Group is when you come with peers. It can be an anxiety group, anger management group, a trauma group, whatever, a depression group, a group for men. Group is really good to build socialization skills and to allow you an opportunity to allow you an opportunity to validate and normalize experiences with each other, right? So groups are really, really good. And sometimes like hospitals will use a group as a step down. So like if you're doing individual therapy and then your sessions are coming toward termination, maybe you'll do a step down into group therapy. So groups are good as well. And then the last thing I'll talk about is confidentiality, and then we'll get into is therapy for you, the discussion. Confidentiality and limits and release of information. So confidentiality, guys, is everything in therapy is confidential. It is, it really is. Everything in therapy is confidential with the exception of uh, threats of suicide with a plan. And that just means that if you say, Dr. Rogers, I'm thinking about killing myself or harming myself, we talk more about that to find out if there's acuity, if there's an immediate risk of harm, chronicity, how long have the thoughts been there, and if there's an imminent plan in place. Dr. Rogers, I have a weapon on my dresser every night when I go to bed, right? And the last thought that I had was this morning before I came to see you. Now we have to talk about possible hospitalization, right? Me, I don't like involuntarily committing anybody, and I've had to do it twice, one to a child, I had to do it 3 times. 2 for a child and 1 for an adult. One, the child's parent left, and I had to take the responsibility on doing it. Another time, it was another child, another child was an adult, and that's because the adult panicked and changed their mind. So I couldn't, I had to. I don't like it, so I always get my patients to agree to voluntarily go to the hospital, and most of the time that works because nobody wants to harm themselves, really, right? I feel that if they're coming to me saying, this is what I'm thinking, that they're saying to me, I really want help,
Yes.
right? I really want help, right? When people think about suicide, it's like, there's no other option. I mean, I'm just so overwhelmed. I'm just tired. I'm exhausted. There's no other option, right? So we talk about that. So don't think that if you disclose that information to your providers, you're immediately hospitalized. I would hope not, right? I don't do that. I talk about it first. And I'm not saying everybody is like that, but I don't. So confidentiality, thoughts of suicide with a plan, child abuse, mandatory reporting, elderly abuse, mandatory reporting, state laws, homicidal thoughts. Each state has its own law. We talked about the Tarasoff warning the last time, part 1. We talked about under confidentiality. If you threaten to harm somebody else, do I have a right to breach confidentiality and disclose that information? Each state has its own reporting laws around that. But most states have a Tarasoff law in place where If I know that you're going to go out and hurt somebody, harm someone, or fatally harm someone, then I have mandatory reporting, mandated reporting.
Mm.
To I'm considered a mandated reporter to report that. If you're in a government facility, or if you're a veteran military person, then it becomes a bit tricky with confidentiality, because you know, in the military is really limited. And Wayne, you can talk about that because you were in the Army.
Yeah.
The military confidentiality, you know, and I have to tell people it's limited. So we take caution in what we write in your reports, because it's limited. And that's with government agencies as well. Most government agencies, though, have the EAP, Employee Assistance Program,
Mm.
and they also, they are good with confidentiality as well. And EAP is short-term referral and counseling services, and they have a good confidentiality plan in place too, requirement in place. So you really don't have to worry about outside of what I just talked about. But just be cautious that when you're in government facilities or agencies, and especially the military, you know, it's a bit tricky when you when you talk about confidentiality. Release of information. Make sure you always sign a release. If there's somebody that you want, except for kids, confidentiality doesn't apply to kids. If you're a minor, then the parents have a right to know. So again, when I'm working with children, I let them know when I'm talking to both them and the parents. Hey, mom, dad, you know, if something comes up that's a crisis or critical or emergency, you know, I'll work with the child to tell you. And most of the times that's stuff like drug use or underage sex
Yeah.
and stuff like that. You know, the parents should know stuff like that, right? So I work with the child to talk to, because again, you know, I take my rapport building and the therapeutic relationship really, really hard. So I think it's important, and I don't like to breach it if I don't have to. So if the child can tell their parents without me breaching that system, then I would prefer the child. But with children, no confidentiality. Okay. Um, but I would hope that parents, if you take your children to therapy, you respect that. Give the children that space to talk
Yes. Right.
without infringing on that, you know, and trusting us that we're going to let you know about what's really, really important.
Yes.
Right. Limit release of information is the last thing I'll talk about. Release of information is you sign a form saying that yes, and this is with EAP within the government agency as well. These are the people that I am okay with you talking to. And that's done during a triage session too. If you're referred by your doctor, to see a psychologist or a psychiatrist, you know, they'll get release of information paperwork all signed out. So whoever you want to that information released to. Now, when I do testing, whoever referred you to me, the testing goes back to that referral source, right? Because you've already signed the releases. However, but if it's anybody else outside of the referral source that you want me to give the test reports to, then you would have to sign another release for that, or you give it to them yourself. Same thing with therapy. Most of the times, like if a husband and wife comes and the wife is the patient and she wants her husband to come in and it's not family therapy, and you know, I usually have them sign a release to have him come in. Same with family therapy. When I'm working with an individual client and a child, adolescent, or that's not adolescent because not children, but 18 or older, and they want their family. I want to do a family session. I have them sign a release for the family to come in. So make sure you have releases signed stating who you want information to be given to, or I always have releases on hand, so that everyone feels comfortable. So that was a lot of information, but that was important information that I can think of at the top of my head. Therapy usually lasts you have short-term or long-term therapy. When I do trauma-based therapy, It lasts for about 13 weeks, 13 to 15 weeks. Even with trauma groups, it lasts for about 15 weeks, and that's evidence-based psychotherapy for trauma work, up to 13 weeks, and for groups up to 15 weeks. Short-term therapy, psychotherapy can last anywhere from up to 13, 16 weeks, 20 weeks. But then you have long-term therapy where you see people have been in therapy for like a year, 2 years, 3 years, right? I'm more short-term based, right? My goal is to get people in, get them what they need, equip them with the tools they need, and then get them out into society so they could practice using the tools as to what they, because I don't want them to be dependent on therapy. However, additional goals might arise and you might need a longer, the goal might change, right? And you might need a longer space to kind of process through stuff. So everybody is different. Nobody is the same. Everybody needs is different. So when you think about therapy, don't compare yourself to what somebody else went through or how long somebody else was in therapy, because everybody's symptoms, just because you experienced trauma and this person experienced trauma, your experiences are totally different. Might seem the same, but it's totally different. Your needs are different. So don't compare yourself to others. So if there's any questions that you guys have out there around the therapeutic process, I'd like to get into the discussion about is therapy for me? And that's what tonight's discussion is therapy for me? So Wayne, you want to add anything about that? Like get this discussion going. Is therapy, how do you know if therapy is for you? How do you know if you should, as a male, because this is men's mental health, building awareness around men's mental health, how do you know if you're a male that you should go to therapy? How do you know if it's even for you?
First off, I want to say that was a lot of great information I think people can always use because again, it's not like there's a blueprint or there's a class out there teaching you about what to do when seeking therapy or in therapy or whatever. So, I think everybody can use the information that you just gave around therapy. And for me, when it comes to therapy, I always say that I think that all of us could use some level of therapy just because of our own upbringing, the culture we live in, from our childhood. And I would say that, I think that for myself, like, as I start to see patterns repeat themselves in my life, right, that aren't working in my favor, right? They're no longer working in my favor, or things that just come up for me that aren't beneficial to me. I start to think about like, man, why do I continue to do this thing over and over again? I think that when that starts to happen, you see yourself continually getting into situations or relationships or whatever it is over and over again, and it's not beneficial to you. I think that's when you should probably seek therapy. Right, when you start to see those patterns develop, you can see them within your relationships, may it be romantic, platonic, work related, whatever. Like you may have see that you're a reactive person, right? What is that reaction? What is that reactionary what reactionary process come from, right? Why are you so reactionary? Like, what you may be a person who finds themselves just angry a lot, or have a lot of anxiety around a lot of things, have a lot of fear. So again, where do all these things stem from? So I start thinking about those, and I would say if you're dealing with any of those things, that I would say seek therapy. To help you process and figure out what's going on with you and why these things keep coming up for you.
Right. And it's hard. I think sometimes it's scary, especially you brought in culture too. Sometimes it's scary to think about therapy, especially how some of us were raised, right? Raised not to kind of depend on therapy, to work things out in the home.
Oh my God.
Especially the stigmas around therapy. In some families, if you go to therapy, then something's wrong with you, or the shame that you put on family if you're in therapy, right? There's a lot of responsibility on you to even sometimes consider going to therapy. And but guys, times have changed.
Yes.
Times has significantly changed, right? And I do think there's more men in particular going to therapy. There's more men, I believe, probably not where it should be, but absolutely more men have started talking about mental health and coming forward with mental illnesses and things of that sort, right? But it takes more validation that's needed, and it takes more of us to say, it's okay. You're not going to be stigmatized. You're not
Hmm.
going to be judged. But, you know, when you had things happening like, um, you know, males being killed that are mentally ill, you know, by police officers and other stuff that you see in the media, nobody wants to disclose that they're suffering with a mental illness, or nobody wants to call to get help
Hmm.
if they're suffering with a mental illness. Like, for instance, um, if you're if you need help and have to call the paramedics or have to call the police, or your family have to call the police, there's such a bad stigma behind that. No one wants to do it.
Yeah.
So then the mental illness goes untreated, right? Or
Yeah.
there's other reasons why mental illnesses may go untreated. But when we're talking about men in particularly, the sign of weakness, right? A lot of men say, you know, how am I going to take care of my family if I'm suffering with a mental illness? I can't deal with that. How am I going to work if I'm suffering with a mental illness? I can't deal with that, right? And so there's so many negative, when you talk about therapy, it's such a negative connotation to that. How do you compensate for that?
Yeah. I, I think that, first, yes, mental health is not a weakness. I think that we've been conditioned to believe that, especially in some cultures, that if we seek out help outside of ourselves or family or whatever, it's like as if we're weak. And I think that that's a that's a detriment to us as men. I think that we have not really had a safe space to process a lot of our feelings and emotions, so we tend to suffer in silence, and that takes away nothing from women suffering and what women deal with as well, but we're just speaking about men. And so I think that, again, a lot of men just they tend to suffer in silence because they don't know that they're not alone. They don't
Right.
know that they're other people out here dealing with same things, similar things that they're dealing with, and it's scary. It's scary to talk about these things because it's vulnerable, and vulnerability is super scary when we talk about things that can seem to be scary. But that's a huge one, right? Being vulnerable is hella scary,
Yeah.
because now you're putting yourself out there, and now you feel as you're worried about possibly somebody taking what you just gave them and weaponizing that and using it against you,
Mm-hmm.
right? So again, you want to make sure you seek out proper help, people who really can hold space for you and help work with you around the things that you're dealing with.
Right. Mm-hmm. I wanted to, and I thought I was going to be able to pull it up. I wanted to pull up this quote, and I'm going to have to post it because Otis James said something that was so beautiful in his article in the magazine around feeling weaknesses, like signs of weaknesses, like to be weak isn't to be weak, but it's to be strong, or something like that. But it was so beautiful as the way he put it, and I wanted to try to pull up that magazine.
Yeah,
I'm going to post what he said because I think it's really significant and relevant to what we're talking about. Um, you know, to say that I need help isn't a sign of weakness. It's actually a sign of strength.
100%. It shows
Right?
a lot of courage.
Yeah. Hmm. And it models to your children. You know, when you're raising children, especially young men, it models to them that it's okay to not be okay. You know, we use that term
Yeah,
all the time, saying all the time, it's okay to not be okay, and it's okay to seek help when we need it. I mean, when you talk about these school shootings,
yeah,
you know, I often think, what's going through their mind? Most of the time, well, all the time it's been men, young boys, right?
yes, yes,
I
yes.
haven't. Has there been a female in a school
I'm,
shooting that you read about? I don't want to say never because I
yeah,
don't know.
I think recently there may have been one, but outside of that, not that I know of.
Yeah.
And even to your point, to go back, I feel like is it, men, if they can understand that if your mental health is in a good space, if you're in a good space with your mental health, you can show up for your family just that much better. But
Yeah.
when you're not in a good, healthy mental space with yourself,
Yeah.
you think that you're out here grinding and working and doing your job, you're really not able to show up for your family. So your family's still hurting. I understand that you may think that you're doing the right thing because you're doing this thing to provide for your family, but in the long run, it's very hurtful to your family because they see what's going on. You're not present. You're not able to show up for them in the ways that they may need you outside of financially facilitating things, right? Because now their emotional needs aren't being met. And that's again is detrimental to kids because now these kids grow up not having that guidance in their life, that they've been missing because you weren't able to show up because of your own mental state.
Right. And so I want to challenge you guys, that's listening, especially if you're men on here. I want to challenge you to kind of reflect, take a moment to reflect on how you're feeling and what you're feeling, and reflect on why, if there's any resistance to saying you need help. Because I think it's important to understand the resistances and why you're guarded around seeking help in order to promote the help-seeking behavior, right? You have to recognize why, and I'm going to repeat that, you have to recognize why there's guardedness around seeking help before you can even engage in help-seeking behaviors.
Yes. Yeah. I think this is something we spoke about before, and it's just, again, repeating is that, a lot of times when men are sorry, I lost my train of thought. I think when they're going through things, I think that they're not really understanding like what's going on with them, like you just said, because they're not paying attention to their bodies and what's coming up for them, and when they do that, they're not recognizing how they're lashing out to other people, how they're reacting to other people, how they're reacting to their kids, how they're reacting to their significant other, their spouse, their wife, how they're reacting to their job, and again, it's just really paying attention to those things. 'Cause I know for myself, when I'm sure that a lot of men can identify with this because of what society puts on us. When we're not making the money that we feel as though we should be making, or we're not where we are in life, where we think we should be, may it be financially, physically, whatever, right? These things cause us pain, right? It causes us anxiety. It causes us stress. And so when those things happen, again, we are now not able to show up for ourselves, right? Which now everybody around us tends to suffer because we not only can we not show up for ourselves, we can't show up for anybody else. And we have to pay attention to these things. And so when we get into these spaces and these situations, that is probably the time that we need to slow down a little bit, see what's going on, and seek outside help and seek assistance, because we don't have to go through it by ourselves. Like there's other ways to process emotions and feelings besides doing it, because a lot of times we don't even know how to navigate our own feelings and emotions, because as we spoke about this before, as young men, no one tells little boys how to process feelings and emotions. They tell us to suck it up. We know that whole thing, and that's what ends up happening. So now, as an adult, since I was never told how to process my emotions, I'm trying to again deal with it within myself, and then it comes out in all these negative ways that aren't helpful to anybody. May it be through violence, suicide, alcoholism, drug use, or whatever. But those are our ways to coping with the things that are going on with us, because again, no one has ever told us how to deal with these things and given us the tools to work with this.
Right. Avoidance.
Yes, 100%.
That big A word that I often use. Yeah, you're absolutely right. And you would be surprised at how many adults, and not only men, but how many adults don't know how to verbalize, don't know how to put words to emotions, don't know how to not only express emotions, but don't know how to put words to it, don't know how to say I'm angry, or I'm sad, or I'm hurt, or I'm disappointed, or I'm emotional, or I'm disengaged, or I'm happy, or they don't know how to actually put. And so I will often pull out an emotions list and have people go through you guys can Google it, because I had kids do it and adults. Pull out the emotions list. There's tons of emotions on there. And you go through and pick out a word that's congruent or that makes sense to how you're feeling. And that promotes communication, because it helps you communicate what you're feeling to other people.
Yes.
Right? Yeah. So it's important to understand that, especially during communicating, and it's frustrating when you can't communicate how you're feeling. That's when you become angry or irritable or frustrated, because you can't, how you're feeling, but you can't communicate it.
and now going back to our point about seeking therapy, because the therapist can help you get these tools to express yourself, and so you don't have to get frustrated, become frustrated, because you start to get
Right.
learn how to express yourself in words that work well for you, that you can that are given to you, so you can express yourself in those moments when dealing with somebody, to let them know how you're feeling in the moment and what's going on with you, so they can have a better understanding of you, and so then that allows them to show up differently for you because they have the information that you've now given
Right.
them.
And it's okay to say when you're communicating with someone, I'm just so frustrated right now because I know what I'm feeling. I just can't explain it to
Yes,
you. It's okay to say that, right?
yes,
And then walk away, compose yourself, and sit down and think about what you're feeling so that you
yeah,
can communicate it, right? It's okay to say, I'm frustrated because I don't know. I know what I'm feeling, but I don't know how to communicate it. I know I'm
yeah,
angry, but I don't know how. I don't know why I'm angry, or I don't know, how to explain why I'm angry, or etc. Right? It's about improving communications as well. And like Wayne said, the therapy is there to help you develop cues and skills and appropriate coping skills, appropriate tools to communicate, help you process through at a deeper
mm-hmm.
level that you probably wouldn't be able to do on your own, um,
Yeah,
to build healthy communications, to mend ruptures.
yeah,
There's a lot of ruptured relationships, right? To mend ruptures. Um, the therapy space is like, your space to use for whatever you need outside of, other unproductive spaces.
yeah.
Um, so
Even
huh?
I was gonna say, even therapists recommend, as you know, recommend journaling, right? Because a lot of times that'll help us to be able to express ourselves. We write it out first and kind of can see it, what we've written about it. Then we can come back and have that conversation,
Right.
And so I think, again, this is ways to just kind of get those thoughts out, to help you process them, in ways that maybe you had never done before. You know what I mean? So yeah.
Exactly. So one way to kind of reflect and to kind of decompress and kind of think about, a lot of times we're afraid to be still, to be afraid to be still in the moment because our minds just run. And me too, guys. I go through this sometimes too, where your mind just runs, just constantly racing. You have these ruminative thoughts. They can be negative, positive, whatever. But your mind's just on a thing of their own, right? A way to manage this is to get comfortable with being still, with mindfulness meditation and relaxation. That I see Kim is on here. Maybe I'll have her come up one session and teach mindfulness meditation and relaxation. Teach you all how to be still and how to become one with yourselves so that you can understand what your body is feeling during an anger triggering event,
Yeah,
or you even get to the explosive stage,
yeah,
right? Feel what your body is feeling during an anxiety triggering event, to
yeah,
understand that this event is an anxiety triggering event. I need to engage in some self-care to help de-escalate,
yeah,
right? So learning tools to kind of be mindful of yourself and what you're going through, what your body is going through, and then being able to work with your body,
yes, yeah.
as self. So
And I know we talked about this before, about misconceptions about therapy, and I think that again, I just want to repeat this. A lot of times that people may think, but therapy is not. You're not coming to therapy to somebody to tell you what to do. That's not what therapy is. Therapy, you don't come here and someone and you say, "Tell me what I need to do." That's not how it works, because you're the expert of yourself. So therapists are here to help guide you and help you navigate your own feelings and emotions, and help you to because help you to seek within and see what, says you're going to come up with the answers. We're just here to help provide the space so you can process all these things, because again, like if we say, hey, this, you should do this, it doesn't work the same, because now you've skipped all the steps to get to where you need to be, and it's not going to be sustainable. But when you do it yourself and you kind of work through them, you understand it, what the process is, now it's sustainable, because now that's a life change. That now you've changed your lifestyle, you're changing your thought process, your mindset, and because you've come to it, this understanding on your own. Again, therapy is not, you don't come here for somebody to tell you what to do.
yeah,
We're just here to help you get to where you need to be for yourself.
good thing. It creates insight. You know, you can't, I don't think that you can engage in behavior change without understanding why you changing the behavior in the first place. You know, you can't decrease anxiety if you don't understand what the triggers are, right? So a lot of people think that, you know, especially with trauma, a lot of people come into the space and say, Dr. Rogers, I just want it over. I just want it done. But you have to realize it's not an overnight experience. And, you know, sometimes when you go to therapy, you feel worse than what you did when you even started therapy.
Yeah. And
Okay?
because a lot of things
Yeah.
get dug up that
Feel
you actually
worse
got to deal
than
with,
what
that
you
avoidance.
feel. Yeah, you feel worse than what you feel. But the end result is a wonderful, I think, a wonderful thing. Once you process and feel uncomfortable and go through all that stuff that you're going through, and then you get to the end of the, you get to the mid, you know, because research shows that you should see some symptom improvement, like after so many sessions of therapy. It's just a great feeling. It's a great feeling. And a lot of people, especially when I was working with the veterans, a lot of people say, Dr. Rogers, I never thought I would be here. I never thought I would be in this space. I know, because you used to say, I'm never going to get over that. I'm never, 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 never. But then it's like when you get to the end, you're like, they don't want to leave therapy. They're like,
Yeah. Yeah.
is time up already?
Yeah. You know, yeah. And, you know, and it's just another real quick point that, you know, again, even therapists need therapy. You know, so therapists, as great as they are and how they show up, therapists need therapy because they need somewhere to process things that they deal with, and you know, and a lot of times, so it's not just that they're coming on here and helping you; they need help as well. So you understand that it's not, you know, it's a ever changing, evolving process.
Right. So, anybody have any questions? Please ask questions about the therapeutic process. So the question was, is therapy for me? You know, that's something that you have to decide. But I encourage you to be open about the process and be open and reflective about what it is that you're going through, what you've done in the past, and has that worked?
Yes.
What you've done
Yes.
in the past, and has it worked?
Mm.
If it hasn't worked, then hey, my thing is, why not try therapy, or why not try something? And if it doesn't work, it doesn't work, right?
Yeah.
But you know, ask yourself, what have I tried in the past? Am I feeling better? Um, are symptoms getting worse? Am I getting angrier?
Yeah.
Am I getting irritable, more irritable? If it, and you guys, again, tell everybody, make sure you do your medical physicals. Make sure you get physicals done, because sometimes mental health will overlap with medical health,
Yeah.
or medical health will overlap with mental health, such as I have hyperthyroidism, and when my thyroid is out of whack, I get depressed mood. I have hot flashes. A lot of stuff go on with me when my thyroid is out of whack. Um, you know, even with other medical conditions as well, with thyroid problems, it mimics panic attack. You
Yeah.
know, so I have to get my levels tested. If my heart is beating really, really fast, I have to get my levels checked to make sure my thyroid is under control before I say I'm having a panic attack. Right.
Yeah.
So
Yeah.
make sure you get physicals done if you feel like, you know, something's a bit off with you. And then if it is, you can rule out the medical, and then you can say, well, let me go see if there's something going on otherwise mental with the
Yeah.
mental illness. There is something called generalized anxiety disorder. We talked about this on one of the prior sessions,
Yeah.
where that's just constant worry. You know, we worry about work, we worry,
Mm-hmm.
kids worry about school, we worry about what's not going to get done, are we going to get bills paid? And there's just constant, tons of worry that you can't control. And it interferes with day-to-day activity, day-to-day functioning, right?
Yeah.
Um, and a lot of us have generalized worries, right? When you talk about depression, a lot of us, we get down. That don't mean we're depressed, right? Some of us get down. I have my down days. Doesn't mean you're depressed, but it's when it causes clinically significant distress, where it's interfering with day-to-day functioning.
Yeah.
If you can't get out of the bed in the mornings, you're not eating has changed, you're gaining weight, losing weight,
Mm.
not intentional, you're having thoughts of hurting yourself, thoughts of harm, you're overwhelmed, You lost interest, don't have interest in activities anymore. Maybe you should go get evaluated, do a consult for depression. If you have anxiety where you're having the rapid heart palpitations, or you have the physiological symptoms such as sweats or ruminative thoughts, physiological symptoms, gastrointestinal problems, other problems going on. Maybe you should get a consult for anxiety. There's different ways you can get consults. Again, start that process, engaging someone to see if therapy is a good fit for you, right?
Yeah, I'm glad you brought it up, because I think sometimes people tend to self-diagnose, right? And I think that you should definitely educate yourself around therapy and finding, a therapist, and just go through a couple consultation sessions, right? Just to see, kind of get a feel for it. It's just, again, do the work yourself, go out there, educate yourself, because I think that, again, I think therapy is very beneficial. Some place in your life you could use therapy, and I think that, it could be so helpful, and to your point, I always, to add on to what you said, I say this all the time. I say, what's the worst, if you've never done it before, what's the worst thing that can happen? One of the worst things that can happen is you can just be right back where you are right now. So you didn't lose anything, but it's a lot to benefit from, a lot to gain if you do it, so, and I think that, just like, there's all sorts of, again, to Dr. Rogers' point, there's all sorts of different therapists out here. If you want a certain ethnic type of therapist, you could find that. You want a man or a woman or certain age, or, all these type of therapists exist. I think that this is probably the one of the best times to seek therapy, because there's so many therapists out here right now who are fresh, new, have progressive thoughts, progressive ideas, want to work with people, are excited, have a lot of energy, understand the state of the world in today, and they just want to be helpful. They want to help us get to a better space, because a lot of people we know are suffering, especially after COVID. We see what happened to a lot of people during COVID and in the aftermath of COVID. So right now is a perfect time to go seek that help and get, just some a sounding board if need be, So,
Right.
Support system is what it is. You just build a support system, and that's just part of your support system. Community, it's part of your community. All these type of things that can be just, again, helpful in your everyday life.
Right. Exactly. Oh my gosh, I was trying to find that quote before I got off, guys. I'm gonna have to post it that Otis James did, and I can't pull it up. It's driving me crazy. I found it, but I can't pull it up on our website, so I'm just gonna have to send it out to you guys. But as we wind down, again, if you guys have any questions, you can always inbox me, Wayne, Dr. Lowell Whiteman. He had a crisis today. He could not be here this evening. So I hope this was great information for you all around the therapeutic space, and is therapy good for you? Again, that's something that you have to decide, but I encourage you to do a lot of self-reflection and understand what's needed for you, without the external noise of somebody else saying don't do it, or
yes,
and again, and guys, let me tell you, I'm a Christian, right? I believe in God and I love church. I do, but sometimes I believe that we need help outside of the church, because the church is how can I say this, ideology or model. The church's model is different than a model of a psychologist or a psychiatrist or etc., right? And sometimes I believe, and I had to tell somebody one time in therapy, they asked me, well, Dr. Rogers, do you think that God is going to punish me because I'm coming to see you? And my response was, is it possible that God put me in place to talk to you? Right. So,
and they can work hand in hand. They can work hand in hand.
Absolutely. We can work collaboratively with each other. And it's okay. It's okay. Okay. So thank you guys so much for jumping on. I hope that this, again, has been great information for you all. We're off next week, but we will be back week after next. Again, we're on every other week instead of every summertime, but we will be back. So if you guys have ready, please check the magazine out, guys, and support Mental Health Talk. All funds and proceeds go toward funding Mental Health Talk and our projects. And we have a lot of projects that we're trying to get out. We just want to make sure the funding is appropriate to get everything out. So we have a GoFundMe page. If you guys can share it, it's called Mental Health Talk. If you go GoFundMe and look up Mental Health Talk, it'll pop right out. Mental Health Talk. And then the magazine, of course, which is selling really, really great. And then I'll come back with that surprise. I'll tell you guys, but I got to tell my writers first tomorrow. Then I'll come back and tell you guys.
Yes.
So excited. Anything else, Wayne?
That's it. I think that, I love helping to educate people, or bring education to people around mental health and therapy, because I'm a huge advocate of us all getting that therapy that we need in life. May it be through a therapist, a mentor, a coach, self-help books, just, I think, again, as long as you're doing something, I think that it's all about growth. So, yeah.
All right, guys. And King Wayne, tell Melissa I said congratulations
I definitely
on
will.
her new business. I'm so happy and proud of her. That is amazing.
Yes.
All right. So we will see you guys in 2 weeks. Talk to you soon.
All right.
Thank you.
Bye.